This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to the latest episode of the Best Health Podcast from Wake Forest Baptist Health. Justin Gomez here, once again joining you to talk about another very timely conversation piece, and hopefully you'll find it informational and useful. Before we dive into the topic of this podcast, I do want to remind everyone, as part of this series of podcast episodes we're doing surrounding COVID-19 and coronavirus, that anyone is more than welcome to visit our Wake Forest Baptist Health coronavirus resource page at wakehealth.edu/coronavirus, wakehealth.edu/coronavirus, or you can call the COVID-19 hotline, and that is manned 24/7 at 336-70-COVID. Now, on that webpage, you'll find all kinds of information, resources, myths versus facts, FAQs, updates on clinic locations and services provided, and symptom checkers, assessments, all that kind of good information. So invite you to visit that website if you want to see more. Also on the website, there is all these podcasts that we've done surrounding various topics around COVID-19. So this is another one today. I'm excited to talk with Rayetta Johnson. She is the stroke program manager for our Comprehensive Stroke Center here at Wake Forest Baptist Health. So welcome, Rayetta. How are you?
Thank you, Justin. I'm very well. Thank you for having me today on this great stroke podcast.
Yeah, absolutely. So Rayetta is here to talk about an important topic. And, you know, as health systems across the country have altered the way that they have done quote unquote normal operations, and scheduling is a bit different, and staffing might be shifted around from place to place. But one thing we want to get across to you all today listening is that for people who need emergent or urgent services from Wake Forest Baptist Health, that we stand ready, open 24/7, 365 still to take care of those needs. And Rayetta is going to talk about an important need that we are still servicing with full capabilities, and that is helping people who might be suffering a stroke or having stroke-like symptoms. So Rayetta, I know this is an important topic, and you have many years of experience around this as a stroke program manager. So to kick things off, just tell us a little bit about yourself, kind of what you do day to day, and how long you've been with Wake Forest Baptist.
Okay, Justin, I'd be happy to do that. I've actually been at Wake Forest Baptist for 46 years now.
Oh, wow.
I came to nursing school here to the Baptist Hospital School of Nursing in 1970, and have been here ever since. And also have always worked within the neurosurgery and neurology department. So I've taken care of patients with neurological emergencies and neurological disorders for 45 years. For the past 11 years, I've actually been completely focused on taking care of patients with strokes. Mm-hmm. So that's been a wonderful opportunity and privilege to be part of our Comprehensive Stroke Center, mm-hmm. as well as our telestroke program that mm-hmm. we have 20 hospitals across the state that we provide emergency stroke consultations for, which has also been a great opportunity and a great service that we've been able to provide our entire state of North Carolina with stroke expert care from Wake Forest Baptist Health.
Okay. Well, we're going to get into a little bit more specific questions here shortly, but I guess just to start off at a good foundational level, remind everyone listening about our Comprehensive Stroke Center and the services that are provided here at Wake Forest Baptist Health.
Okay, I'd be happy to do that. We are a comprehensive stroke center, so that is the highest level of certification from the accrediting body of hospitals, the Joint Commission. So therefore, we are able to provide all levels of care, even the highest neurosurgical type interventions. So for emergency stroke care, there's basically two major treatments that we can provide as a comprehensive stroke center. There is the intravenous medication called TPA or Activase that we can give immediately to those patients that meet the criteria to give that medication. And we always say the sooner the better, that time is brain. So as soon as we can deliver that medication intravenously, the patient's outcome usually is greatly improved. So we're always trying to decrease the time from door, the time the patient enters our door in the emergency room. We're immediately getting a CAT scan, which is one of the first diagnostic exams we have to do, and then get that medicine ready to deliver to that patient quickly. Then there's another an emergency treatment that we have available. It's called a thrombectomy procedure, and that patient that is a candidate for that procedure is immediately taken to our radiology, to our X-ray department to have that procedure, which our neuroradiologists are able to actually go in and abstract or remove a blood clot from a blood vessel in the brain that's causing the stroke.
Wow.
So that's pretty amazing because I've seen patients come into the emergency room possibly totally paralyzed on the right side, for instance, and then we give them the clot busting medicine, start breaking up the clot, dissolving that blood clot in the brain vessel, and then we take them to this interventional radiology suite, and then we are able to abstract or remove a large blood clot from a large vessel in the brain. And so we've totally restored blood supply and oxygen to the brain. And the patient, when they leave the radiology suite, is totally back to normal after those procedures.
That's amazing.
It is. It is totally amazing. It's just one of the most gratifying things that you can do as a healthcare professional, is able to see that patient totally come back to normal, basically, before your very eyes. It's pretty amazing. So, but the caveat here is patients have to recognize the signs of a stroke and then call 911 immediately and get to the emergency room. So we can do these things because these treatments are time sensitive.
Sure. Now, I'm glad you said that. Remind us what the main signs and symptoms of a stroke are, so that if, God forbid, we or someone that we're with, one of our loved ones, starts showing some of these signs, we might be prepared to take action.
Okay, absolutely. And there's there's a fast, if you will, a fast mnemonic that's kind of easy to remember, if you will. If you remember, F is for face. So just ask someone to smile. And if they kind of have a sidewise smile, if they're not able to bring both of their mouths up, so they kind of have a crooked smile, if you will, that could be a sign that one side of the face is weak, so they can't smile normally. And in the fast mnemonic is A is for arms. So just ask someone to lift up their arms. If they're not able to lift up one of their arms, or one of their arms is weak, and if they're able to lift it but it drops down quickly, that means that their arm is weak, could be caused from a stroke. And then the third little test you can do, or for the S for speech in FAST, is just ask someone to say a simple sentence like, "It's a beautiful day in Winston-Salem," or wherever.
Mm-hmm.
And if their speech is clear, easy to understand, that is good. Then their speech center, that means their speech center is not affected by the stroke. But if their speech is like very garbled and mumbled and difficult to understand, very slurred, or maybe unable to speak at all, that's a big sign of stroke happening. So those are what we call the main symptoms, or I guess the most common symptoms of stroke. But just to be totally complete with all the signs of a stroke, there are two other symptoms that can happen, which are vision. All of a sudden you lose total vision, or partial vision, or part of your vision is blocked out.
Okay.
And then the other symptom is balance. If all of a sudden you get really, really dizzy and kind of lose your balance and fall down, that's a big sign of stroke also. That's more of a, what we call a posterior circulation stroke. But so any of those signs. And then the last sign is worst severe headache of your life. Like all of a sudden your head feels like it's going to blow off your shoulders, kind of headache.
Yeah.
That can be a sign of a, what we call a bleeding kind of stroke. There's basically two types of stroke. There's the blood clot kind of stroke.
Okay.
And there's the bleeding kind of stroke. Just to really simplify it. So 85% of strokes are caused by blood clots just blocking off the artery in the brain, not allowing blood supply to get to a part of the brain. And then there's the other kind of stroke that's makes up about 15% of all stroke, which is the hemorrhagic stroke, the bleeding kind of stroke, that when you have an aneurysm in one of your blood vessels in your brain that ruptures and bleeds into your brain. Or sometimes there's something called hypertensive bleeds, where just your blood pressure gets really, really high and may cause a blood vessel to rupture in the brain and cause a big, massive hemorrhaging or bleeding in the brain. So I hope that's not too complicated, but
okay. Well, going back to the FAST acronym, we touched on FAS, and what's the T?
That's a great question. T is for time, actually. So that means every minute counts. So as soon as you have any of those symptoms, call 911 immediately and get to the nearest emergency room.
Okay. So, that's a great segue. Time. Why? Maybe you touched on this briefly earlier, where you said time equals brain. That's pretty straightforward. But why is it so important for people to get into a medical facility and start getting treatment as soon as possible? What's happening there?
Oh, excellent question. 1.9 million brain cells die every minute after a stroke happens.
Okay.
So we're losing a lot of brain cells.
Yeah.
So that's almost 2 million brain cells dying every minute. So that puts it in black and white for me that, brain cells start dying immediately. And we want to stop that because that can continue to occur over many hours.
Yeah.
So as soon as we can stop that, our brain cells from dying, absolutely, obviously that's the best thing to do. So, so that's kind of it in a nutshell. We just want to prevent the further death of brain cells after a stroke occurs, because there's an area, it's called the core infarct. There's a core area in the brain that dies immediately when a stroke happens, but then there's continuation of brain cells dying, expanding, and dying beyond that core. So what we're trying to do is prevent that from happening.
Yeah. So I think one of the main points you all at the Comprehensive Stroke Center were trying to get across with today's podcast is, it's the COVID-19 coronavirus is still, in our media cycle almost 24 hours a day, if you'll let yourself listen to it that long.
Right.
And there seems to be, some pent up apprehension or even fear among some people of, maybe not wanting to go to any emergency department or urgent care facility. But you're here to tell us, and one of the main points is to remind us that you need to come to the ED as soon as possible if there's stroke signs and symptoms, correct?
Correct. Absolutely. Yes. Because Wake Forest Baptist Health has prepared very well for these for this pandemic, and we actually have put a lot of policies and procedures in place. So actually, for just the emergency room patients that come in, we now have two separate entrances. We have one entrance for patients with COVID-19 symptoms, and then we have a separate entrance for all other emergencies. So of course, stroke patients would go immediately, they would be fast tracked, if you will, straight into our emergency room and actually immediately taken to the CAT scanner for treatment to start the process of diagnosing and deciding the best treatment for that patient.
Yeah, so people should not be weighing or contemplating, maybe we'll just kind of wait it out for a little while and see if this person, gets better or their symptoms kind of go away after a little bit. And then, maybe we don't want to go to the ED right away. People should not be thinking that way, correct? Because
absolutely not. Yes, we want them to come immediately. If they this pandemic should not really change the way that the community thinks about stroke, that it's still, stroke is an emergency. We only have a few hours that we can provide these emergency treatments. So as soon as symptoms start, a patient or person should still immediately come to the emergency room. Strokes don't wait for this pandemic to pass. People I'm afraid, are still going to have strokes.
Yeah.
And so, we at Baptist Hospital have prepared for this. So we've made all these plans and protocols and procedures to still safely take care of all patients, whether they do have COVID. We still, are taking very good care of COVID patients, and also all the other patients that are having all the other things that have gone on before COVID happened,
Sure.
So like strokes and like heart attacks and like all these other emergencies.
Sure. That's a good point, Rayetta. So Rayetta Johnson is talking to us today on this Best Health podcast about just reminding us that if stroke signs and symptoms are happening, people need to take action immediately. And I'm glad you brought that up with patient safety. Patient safety is top of mind and a top priority.
Yes.
Every day, regardless of whether a pandemic is happening or not. But, you mentioned that there have been additional policies and procedures put in place to just make people who come onto our campus as safe as humanly possible, correct?
Yes, absolutely. We have done everything to keep the COVID virus contained and all of our patients safe.
Yeah. Okay.
So we are still, as always, we are still protecting and caring for our patients, to the very best of our knowledge.
Sure. And that's an important point, and people should listen to Rayetta about that. That's please do not delay seeking treatment if something emergent like stroke symptoms are happening. Rayetta, I also wanted to ask you, shifting back to kind of the treatment and strokes, there's different severity levels of different strokes, I'm sure. And so you all are still prepared to care for patients as long as they need patient care. And if you just want to talk to us about just kind of the process of after those initial procedures are administered, if people need longer term care, you're there to help support them through that as well, correct?
Yes, absolutely, Justin. We do emphasize emergency care of stroke, of course, because stroke is an emergency. But also we provide care across the continuum of stroke. So we have a special dedicated neuroscience intensive care unit.
Okay.
Where our stroke patients go to after receiving those emergency treatments that we talked about earlier. Then they will be cared for in our state-of-the-art neuroscience intensive care unit. Then after their initial acute phase, we'll call it, and everything's stable and they're doing well, then the patient will be transferred to our neurology and or neurosurgery units, where nurses are specially trained to take care of stroke patients. Then after moving from that phase, if the patient does need further physical therapy, occupational therapy, speech therapies, and are a candidate for inpatient rehabilitation, we do have the Stick Center rehab facility that we can move appropriate patients and to continue their rehabilitation from stroke. We also have outpatient rehabilitation. So some patients, maybe they're doing very well and they really don't need that inpatient rehabilitation, but so they can go home, but they may need some outpatient physical therapy, occupational therapy, speech therapy. So we do also provide outpatient therapies as well. So we want the best for our patients. We want them to have the very best outcomes possible. So we tailor our care for each individual stroke patient to what will best serve them and will best help them get back to their normal lives and activities in their communities.
Yeah, that's great information, Rayetta. I appreciate you kind of walking us through that. This good information for people to realize that, you're still there every step of the way to get the patient the best care possible. So
yes, and actually I wanted to also add this, if you don't mind, Justin.
Yeah.
That we actually have post-stroke nurses that call patients after they do get home. So like in just a couple of days after if they are discharged straight to back home, then we do call them and check on them and see how they're doing. See if they, if they need anything, because there's so much going on when a patient's in the hospital. It's just a lot. It's almost overload.
Yeah.
It was all the information that we give them. So now we're actually have a special post-stroke program that we're calling patients and checking on them and seeing, if they do identify they do have further needs after they get home, or they have questions after they get home that we can help them with. And then we also, of course, have follow-up visits at Wake Forest Baptist. And I will add this, with the COVID pandemic, we are now seeing more patients virtually, if you will. So patients, may not need to actually come into our clinics for a, person-to-person, face-to-face visit, but so we can do what we call telehealth or do virtual visits with patients. So that's kind of been a little change also, that we're doing more virtual outpatient visits, just to kind of add that to the discussion.
Yeah, thanks. That's great information, Rayetta. I did kind of want to wrap up. We're getting close to the end of our time with this episode today. Maybe one of the best things that you can help us with and remind us is the best way to stay out of the emergency department with a stroke is to, mitigate certain things that can lead or contribute to a stroke. So if you want to just take a second as we're wrapping up here to talk about, to help us reduce the risk of stroke in the first place, what are some wellness tips that you want to give the listeners?
Okay, great. Thanks. Yes, absolutely. That's exactly right. We would just love to prevent strokes, and strokes are preventable. Almost 80% of strokes are preventable. So very quickly, the things that cause stroke or increase our risk for having stroke are high blood pressure. High blood pressure is the number one cause of stroke. A high cholesterol, diabetes, smoking, alcohol use. Actually, the American Heart Association does say that 1 drink a day for women and 2 drinks a day for men is acceptable. Illicit drug use, of course. We see a lot of young, healthy men and women come in that have been using street drugs and have these massive brain hemorrhages. So all that's not good. And we always encourage physical activity. So the easiest, cheapest activity is, of course, walking. So walking, 20 minutes, 5 days a week is great exercise. And now, since many of us are staying at home more and it's beautiful weather outside, we can all get out and do that, 20 minutes of walking a day. That's great. And of course, just eating a healthy diet, trying to eat low fat, low cholesterol type diet, eating a lot of fruits and vegetables, and limiting your proportion size is actually a great thing. Like a serving of meat is the size of the palm of your hand. So trying to limit red meats, eating more fish and chicken, those type of things. All those things are great ways to try to improve our health and live more healthy, if you will.
Well, that's great information as well to wrap up, Rayetta. Thank you so much for taking time and talking to us today about the importance of the need for people to still seek out treatment as soon as possible if they or someone they know is experiencing stroke signs and symptoms. It's very, very pertinent and timely reminder, even though we're going through this challenging time of COVID-19 and coronavirus, that you all are still there and ready and capable to take care of us should we need it. So I really appreciate your time, Rayetta.
Yes, thank you very much, Justin. I really do appreciate, and I just hope that everyone listening today will take advantage of our stroke expertise at Wake Forest Baptist Health. We are here for you, and as soon as you recognize those signs of stroke that we talked about earlier, and call 911 and get to our emergency room, we'll start providing the absolute best care available.
Yes. Yeah. Good reminder, Rayetta. And if people want more information about the Comprehensive Stroke Center, all they have to do is go to wakehealth.edu/stroke. That's wakehealth.edu/stroke. And there's lots of great information and resources available on their website. So Rayetta, thanks again. Everyone listening to this episode, we appreciate you taking the time to listen today and share this information, hopefully with your friends and family. And until we chat next time, I just want to encourage everyone to please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.